The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Wonderfully Made. My name is Amy Wellard. I'm from the Wildwood Lifestyle Center in Georgia. And with me today is Dr. Sherry Lou Fernandez. Welcome, Dr. Sherry Lou.
Thank you.
Today we're going to be talking about a very, very sensitive topic, fertility and infertility. Now, Dr. Sherry Lou, this is a very pertinent subject for myself, actually. My husband and I, we tried to conceive for several years. I think it was about 4 years before the Lord blessed my womb, so to speak, opened my womb, as the Bible says, and blessed us with a lovely and healthy son, which I'm very thankful for. But I can really relate to the struggle that so many women are going through in fertility and not being able to conceive, and all the struggles, emotional struggles that go with that. So tell us, how does a woman know technically whether she's fertile or not? When it comes to that time she wants to have a baby, how does she know if her body's going to be able to do it?
First, you know, as if you were going to go back to the previous, if your cycles are regular, most likely you will, you know. If you have a regular cycle and there's not so many problems associated with it, and you're most likely going to have a baby. But if you've been married for a year and you have not had what they call this, you have had uncontrolled sexual intercourse and you've not had a baby, you probably are infertile. And or if you're married and above 35 years old and have not had controlled sexual intercourse, you know, for 6 months, you fall under the category of people who are infertile.
So, and of course, infertility increases as we get older.
Yes.
I think 35 is the point where things start becoming a little more difficult.
Yes.
So typically, a woman that cannot conceive is, the problem is considered hers generally. We tend to think of the woman as being the problem, but it could just as well be the man. Is that right? That's having this.
That's true. Statistics will say that when a couple comes in for infertility workup, you know, they have been having it 1 year and they don't have a baby, and we try and see where the problem is. You know, I had a patient who came into my clinic one day, and she was with several other doctors from year after year after year, 7 years in fact. She was going to different doctors hoping that she could get pregnant, and she came to me. And I said, oh, where's your husband? You know, I tried to do follow-up on her, but I couldn't get her pregnant for six months, you know? And I said, let's just check your husband first. It turned out that it was her husband. So 13%, I mean 1/3 of infertility cases, you can say the woman has the problem. 1/3 of cases, you could say the man has the problem. And the other third is both of them have problems.
So actually, the man could be just as much the problem as the woman?
Yes.
Well, that's news to me. So if the man is really having some fertility issues, what could be the cause?
Okay. There are two causes, really, but it's just intertwined. One is probably the man cannot produce the sperm. Okay, so there must be problems in his testicles, that sperm is not being produced. Examples of this is, well, you know, how can you get your how can you get your testicles not to produce sperm? When you're in an environment that's always hot, you know, always, your body's temperature is always high, and sperm is not produced. When a person takes illicit drugs, it ruins these testicles from producing sperm. When the person wears, you know, tight jockeys, you know, and it's makes the hugging on the body, increasing the temperature of the testicles. The sperm is not made. And there's so many other circumstances, in not even eating well, you know, and infections of the testicles can cause the testicles not to produce sperm.
And is there any other physiological reason from inside the man, for example, varicose veins?
Oh, yeah. He may be able to produce the sperm, okay? Let's say the testicles are fine, they're working fine, producing their stuff from day to day. However, if the passageway of the sperm to go out is clogged, such as when they have varicosities, you know, varicosities that are choking the passageway of the sperm. Sperm cannot go out. You know, if he had infections in the past that would scar the epididymis, you call that. It's like the one that matures the sperm on top of your testis. It's a structure before it goes into your passageway. It can be scarred and there's no more passage. So you have the sperm, but there's no passage, so you don't get the sperm.
And is it possible that the sperm could be mutated in some way so that even though it arrives in the right place, it just doesn't have the material to make it happen?
There are, if you would look under the microscope and when you're doing a sperm count, you'd see a lot of normal cells in a normal person, but there are times when there are double-headed sperms, you know, and funny-looking dumbbell sperms. And the number of that, if it's increased, if you have slow-moving, sluggish little things or funny-looking stuff, they can't fertilize.
Okay, so let's go back to the woman. Let's go back to us. What is it about us or our eggs that could be causing us to have such a difficult time in conceiving a baby?
Oh, okay. There are four major causes why women can't produce a baby. One is like if you'd say the testicles cannot produce sperm, the ovaries, on the other hand, cannot produce the eggs. Okay, there are infectious diseases or autoimmune problems that can cause your ovaries to scar, or you're having polycystic ovarian syndrome, anovulatory cycles, hormonal imbalances that your ovaries just don't produce the egg. Okay, so then you may not be you will not be fertile. You don't have the egg.
Right.
So anything that can cause the ovary not to produce the egg is one major reason why a woman can't get pregnant.
Now, when we were looking, my husband and I were trying to conceive, obviously we felt that the Lord had promised us a child, and but we also felt we needed to play our part in making sure that we had everything right. And that was, to be honest, that was when I really started to understand some of these things that I didn't understand when I first got married that I wish I had understood. And one of them was in the signs that a woman has when she's approaching ovulation. And there are certain signs that we can know. And for those of you at home, you can know this even if you're not even married. You can know when you're ovulating by these body signs. Could you tell us about those?
Okay. This ovary, when it releases the egg, you call it ovulation.
Right.
Okay? When you would have an idea more or less that you ovulated, your ovary that's supposed to give out an egg has released its egg. Okay? And you are now the first cause of infertility. You have hurdled because you produced an egg. Yeah? When you produce an egg and it went out, you call that ovulation. There is a change in hormones in the body, and especially you would have an increase in fluid. You regularly, I was told by my teacher when I was still younger, and I wonder why they taught us in elementary, but you would know that you were ovulating because there would be this stretching out of the cervical discharge. We have a discharge from day to day, yeah? You should, maybe it would be a good habit for a lady or a woman to look, to see the discharge. And when the discharge goes like this, like mucus, you know, the discharge is mucousy. If it is cheesy like, you know, and or, you know, rubbery, what you'd say, the sperm can't go through, it can't get to the egg. But when it goes like this, then that means you ovulated.
Okay, because it's stretchy.
Yeah,
and it's,
your hormones are just par.
oh, so everything's ripe. if you
Yes,
like.
ripe in
for the
other
pickings.
words.
Ripe and ready. Okay, so that's the time. If
Eggs
you're
have
wanting to conceive,
introduced.
that is the time to say, husband, time to come home.
Yeah, that's the time.
And it's amazing how a little piece of information like that can make a huge difference, because many of us women, when we're at school, when we're in high school, we really think the only time we could conceive is pretty much any time. In other words, if you had any relationship with somebody, you could get pregnant at any time in your cycle.
No, there's a specific time.
And that's a very short window of
Yes.
time. Could you tell us about that window?
Okay, the egg, when it's extruded or ovulated out of the ovaries, has a 24-hour lifespan. It can probably go a little bit more, but if you would really want to get pregnant, there is a golden opportunity to have the optimum fertilization and the optimum fertilized egg. And that is, although they say the egg lives for 24 hours, I'd rather be very conservative and say the first 12 hours after ovulation is the best time for conception.
The first 12 hours.
The first 12 hours, yes.
After ovulation. Yes. So as soon as you get that sign, you know you've got about 12 hours where there's a maximum opportunity.
Actually, if the husband is close by, it's not really a problem, because our hormones will make us more amorous. You will just not believe it, but you will go to your husband and be more tender. You'd be more, you know, whatever I'm getting at.
Okay.
You'd be more, you know, you just be nice to your husband. You don't know, you would not be nice to your husband on any other time, but this time you would be.
The body does
it's the body, the body's pushing you to do it.
The body's telling you. Okay. So are there any other signs?
Oh, okay. What? For
ovulation. When people are wanting to conceive, very often they will chart their body temperature, their basal body temperature.
Okay.
And it's
a
little bit of an inconvenient thing to do. You have to do it first thing in the morning. But how effective is it at locating ovulation?
It is really one of the important things you have to do, because when you extrude the egg, or the process of ovulation comes, you know, even before, progesterone will start to be released slowly by your ovaries. And when this happens, it shifts your temperature higher, okay, by about 0.5 centigrade, or maybe almost a Fahrenheit, or maybe half a Fahrenheit, but half, you know. So if you had 97.6, if it would go, the average was 97.6 every morning before you get up, before anything else, you know, even before drinking water, or even before talking, because when you talk, wind gets into your mouth and it cools your tongue down or whatever. Before anything else, put that thermometer in your mouth and take your temperature. No drinking water, first thing, and then you plot it. Then you have a regular, you know, you take your average. It's 97.8, let's say, or 98. If it goes up to 98.5 and it stays there, more or less, you have ovulated. It stays there up to the end of the cycle. That means you have ovulated, because your hormones are going up. Okay. Your progesterone's going up. That means you won't have progesterone unless you ovulated.
So that, combined with the cervical mucus, is a very good sort of double confirmation that you're ovulating.
So do that so that you don't have to work so much time, you know.
Okay. And now, as we mentioned earlier, women that are 35 and older and over will perhaps not ovulate as frequently as younger women. But I want to say, as a word of encouragement out there, that There are many women over 35 that have very healthy babies. I was one of them. I'm very thankful. And yourself, you are one of them.
Myself too, yes.
And so you don't need to give up hope. It's very possible, even though the chances of conception actually are cut by 50% every year. Is that right?
Yes.
With each increasing year after 35. But I found out recently that there were over 100,000 live births to women between 42 and 44 in the U.S. in 2006.
It's because they have a lot of ways to make it work.
Ways to make it work. And so today we're not going to be so much talking about the conventional ways of increasing fertility, but just tell me a little bit about other factors that can really be compounding the situation if some of our viewers are having a hard time to conceive after a year. For example, I heard of polycystic ovarian syndrome, endometriosis, these things. If the woman is having issues with these things, this could be impacting her chances.
Okay, yeah. Let's deal first with just shortly, very short on endometriosis. Endometriosis is the lining of the uterus outside of the lining of the uterus. You know, it may be embedded in the fallopian tubes and or in the pelvic cavity. And if it were around the area of the fallopian tubes, when that happens, the fallopian tubes scar. Okay, they scarify, and when they scarify, you block the passage, so sperm can't get to the egg. So that's another factor why you can't get pregnant. You have an egg, but the egg is never fertilized because the sperm can't get through your scarred fallopian tubes because of your endometriosis. Okay, so that's another reason why you can't. Endometriosis is you know, one of the main causes of endometriosis is having painful menses, cramping pain, causing blood instead of going out this way, goes through the fallopian tubes and implants this endometrium outside, causing scarification of your fallopian tubes.
And just a note on that, if you are having any of these symptoms, we do encourage you to see your healthcare provider or your physician and just get some clarification there, so that if that's impacting your desire to have a baby, that really your healthcare provider can help you with that. Well, so what can we do about polycystic ovarian syndrome impacting conception?
So, polycystic ovarian syndrome is when it manifests as infertility. Usually it's associated with an overweight lady, you know, can't get pregnant, and not having menses regularly. Sometimes it's only once in a year. It is an,
oh, really?
Yeah, it is a diagnosis clenched by an ultrasound when they see the ovaries with several cysts. You know, they're not really cysts, they're just eggs that have grown so big and waiting to ovulate but have not been given a chance because of hormonal imbalance. The luteinizing hormone not being there and causing the release of the egg. So all these mature or full grown, ready to burst out are not bursting out. So you don't have an egg. And many times polycystic ovarian syndrome, more often than not, is a lifestyle problem, you know, usually associated with poor lifestyle and overweight women.
And it's on the increase.
Yes.
Along with metabolic syndrome, diabetes.
Yes.
Right.
Yes.
So let's look on the positive side then. Let's look at the natural remedies that we can use to increase our fertility. I read actually recently that evening primrose oil can increase the amount of the cervical mucus so that you can pinpoint more effectively when you're ovulating.
That's true.
Which I thought was wonderful. That's something you can just take as a supplement with your meals.
Yes.
Is there anything else that we can do that will really improve ovulation and improve the effectiveness of the sperm getting there?
We really cannot overemphasize how important the natural remedies are. When we that's why we would want really a person who's even thinking of getting pregnant. You can work on your fertility. I think it should be in your heart, being a woman, and maybe a young woman not yet even married. It should already be in your heart that if you really want the baby, if you want the baby, you should take care of yourself at least 3 to 6 months in advance before you ever get married. Because lifestyle, you know, when your body has been zonked, it takes time to repair. But you can be sure that if you do take care of your body, you get your menses regular, your hormones will come regularly, any inflammation can be fixed, you know, exercising, drinking water, sleeping early, being in the sunshine, getting your vitamin D, and all this, especially trusting in God. You know, you cannot, that is very important. And all being temperate in all things, these give you a very, very big chance, you know.
Right.
How can you ask the Lord to bless when you're not following His requirements? You know, it has to be that you follow the requirements before you ask Him. And He's gracious. He gives us many times even if we don't. But then if you're asking, wouldn't it be nice for you to just follow the instructions?
I think that's a beautiful point you just made. It's important that we trust God with this issue, and that He really knows what's best for us. If having a child is the best thing, or if He has a different plan that's still going to be the best plan.
Yes.
And I think both of us had children that was kind of a surprise to us, because we were both naturally not the kind of women that really crave to have children.
The funny thing is, you when you had your husband and you were impressed that you wanted a child, then the Lord gave you a child.
Right. Right.
My husband and I is a different thing. I married my husband on the premise that we were not going to have kids.
Is that right? And he agreed?
And we were, yes. And we were working on it really hard, you know, really, really hard. But we can't usurp the will of the Lord. You know, He has His ways of working in our lives. If it's His will, like I didn't want a baby, the Lord gave me a baby. I can tell you, if you want to talk to me seriously about this, it will take a long time. I'll tell you all my guts. But anyway, the Lord gave me a baby when you know, He just gave me a baby when I was surprised, but I was glad. After now, I'm really glad the Lord gave me a son.
Of course, and myself also. And God's plans for us may not be our plans for ourselves, but we have the promise in Romans chapter 8, verse 28, that all things work together for good to them that love the Lord. And so we can always claim that promise. And I think, you know, it's interesting that many times when we relax about this issue, if we can talk about that, relaxing about it, it's a topic that when you want a baby, it's so hard to relax about it. Every time you see another baby, somebody with a baby, it fires off those emotions. But, you know, when we can learn to relax, it's often then that the Lord brings that blessing.
That's
because
true.
the whole body is relaxing.
Is
and the hormones are coming into balance.
When you finally accept that the Lord has a will for you, and even if you don't know the will of the Lord, it might just come. Oh, I have to tell you this story. A friend of mine, azoospermic, 0 sperm.
Okay.
Oh, he had a big issue in his past, you know, really bad, that he had 0 sperm. But he was married for 12 years with a 0 sperm. You won't believe. After 12 years, he was working for the Lord as a Bible. He became a pastor, Bible worker first, working hard as a Bible worker. Then he became a pastor. On the 12th year of his married life, azoospermic, the Lord gave him a child. 3
children.
Yes.
That's
I really thought he would never have it because I thought his thing was done.
That's wonderful.
But the Lord, He does not only open the womb, He opens this thing.
Oh, that's
too. So you never know what the Lord is going to give you.
He's in control.
He is in control. And submit with all your heart.
The Lord really knows what we need. He's so good to us, and He also gives us the information for us to take care of ourselves.
Yes.
And I want to pick up on a point you made earlier about nutrition. We hear a lot about folic acid deficiency and neural tube defects in infants. Please tell us, when should we start a folic acid supplement if we need to do it?
Okay.
How do we know?
I think you should even before, you know, it's very important to have a normal folic acid already before you get into this fertility infertility business, because you don't want to be taking it when you're already there. But take it before. There's a lot of folic acid in all the vegetables and all the beans and the grains, you know. So eating properly, and if you would want to, you can you could even take a supplement.
A supplement.
To get your folic acid up to normal.
Okay, good. And what about other herbal agents that we can use to increase fertility?
Okay, one that I can say with real certainty is back home when I used to be practicing taking care of a lot of infertile patients. We don't have a lot of the herbs you have here in the States. You have a plethora of all the herbs. But I had one of the best ones, you know, it's dong quai.
Oh, we have that here also.
Yeah, you do have that
Wonderful,
here.
yeah.
It is, and that was the only one I had, aside from the lifestyle. And I was really strict with the lifestyle. Follow these instructions to the T. And on top of that, I'd give dong quai. And dong quai helps regulate the menstrual cycle, even for the man. It also helps these hormones so that he's able to make the right, the optimum, the best sperm and the best egg for both of them.
Oh, so you're saying the man takes the dong quai as well as
the lady? Yes. If the man has problems, he could take the dong quai as well.
And do you have some experiences where you can testify that that really helps?
Yes, a lot of times, many patients, because I was the only one who was going into natural remedies around. I mean, the other doctors wouldn't do it. They would just go straight to the drugs. Well, I usually started first with the natural remedies, and then if I couldn't work on these natural remedies, I'd go to the last resort, which were the drugs. But many, if not more than, they would get pregnant here instead of there. You know, there's some who I don't believe in natural remedies. So then they go straight to it's funny, but these ones on the natural get pregnant faster than the ones here. I just,
that's
I don't
good
know,
news.
but that's what I found out.
You know, Dr. Shirley, for some people, the issue isn't just having a baby, but it's really wanting a girl or really wanting a baby boy. And if you're at home and the gender selection is really an issue for you, we'd just like to just touch on this just briefly, that there are ways physiologically that you can increase your chances of getting the gender that you actually want. Can you tell us about that?
Oh, in my practice, this is almost, this is 100%. If when you ovulate, you have your sexual contact on that day and not 3 days before, at least 3 days before, you'll get a boy. Okay, so if I'm ovulating today, I didn't have sexual contact within 3 days of my ovulation, I get a boy. If I have contact around 3 days prior to my ovulation, I get a girl. And I don't have contact on ovulation. So contact before ovulation gives you a girl. Contact on ovulation gives you a boy. There's physiology behind it. And I believe it's true because I've seen it over and over again.
Oh, that's very exciting to know that. Of course, it relies on the fact that you have a regular 28-day cycle.
28-day cycle.
Or that you ovulate when you know you're going to ovulate, so you can pinpoint that.
Yes.
But even if you
Very
don't,
important.
Prayer can cover it, and we know that Jesus will give us the gender that He knows is best for us.
Exactly.
And so we can just give Him thanks for the decision that He's going to make.
Boy or girl.
It's out of our control, ultimately.
That's true.
Dr. Shirley, thank you so much for joining us on the program today. And we believe and we trust that you've been blessed with this information today. And I've learned something. And I hope it's going to be of help to you, ladies, and to your husbands. And as you go on this journey of seeing God's will for you and whether to expand your family or even just to have your first child, put it into His hand, trust Him. He knows what you need, and He's promised to provide it. God bless you.